Okay, so you're sitting in the doctor's office, and you hear those words, you have high blood pressure. I know exactly how heavy that moment can feel. Honestly, it's overwhelming, it's confusing, and quite frankly, it can be pretty scary. But I need you to take a deep breath right now, because you are in exactly the right place. Welcome to this explainer. Today, we're going to take all that confusing medical jargon your doctor just threw at you and transform it into your ultimate survival guide. We're going to break down exactly what's going on inside your body and, more importantly, hand you the exact tools you need to take your health back.
But first things first, look at this number, 103 million. That is the massive number of American adults who shared this exact diagnosis with you right now. And it's a global thing. Over 8.2 million adults in South Africa are dealing with this too. In fact, globally, roughly 1 in 3 adults has high blood pressure, and a lot of them don't even realize it yet. So if you're sitting there feeling isolated, let this be your proof you are absolutely not alone in this fight.
Okay, let's dive into this. To get you back in the driver's seat, here is our game plan for today. 1. We'll demystify your diagnosis. 2. We'll look at the sleep and stress connection. 3. Perfecting your home readings. 4. Your new 30-day habit plan. And 5. Partnering with your doctor. Starting with part 1, demystifying your diagnosis. Basically, your blood pressure is just the force of your blood pushing against your artery walls. And you always get two numbers, right? The systolic number, that's the top one, is the pressure in your arteries when your heart actively beats. The diastolic number, the bottom one, is the pressure when your heart rests between those beats. The golden rule, the baseline you want to remember, is that normal is below 120 over 80. Now, if your numbers ever spike higher than 180 over 120, that is considered a hypertensive crisis, and that absolutely requires immediate emergency medical attention. But what does all this pressure actually do inside you?
Think of your delicate arteries like a garden hose. If you crank up the water pressure inside a hose way too high, what happens? The material stretches, it bulges, and it takes on incredible stress. Over time, that constant pounding pressure damages the inner lining of your arteries, something called the endothelium. It literally creates these tiny little tears where dangerous cholesterol can sneak in and start building up.
And this is exactly why this condition is known as a silent killer. You can feel absolutely fine, like totally normal, for years while massive damage is happening under the hood. That plaque buildup we just mentioned, that leads directly to heart attacks. Those weakened vessels, they can rupture or block in the brain, causing a stroke, which, by the way, is really best thought of as a brain attack because people literally never see it coming. It also damages the tiny vessels in your kidneys, so they can't filter waste properly, and it restricts oxygen to your brain, which research strongly links to cognitive decline and dementia down the line.
Which brings us to part 2, the sleep and stress connection.
Now, what's really interesting here is how chronic stress plays into this. A healthy, relaxed blood vessel can quickly become choked and constricted when you're constantly stressed out. When you're stressed, your body just floods with hormones like cortisol and adrenaline, and these hormones literally command your blood vessels to tighten up, which forces your heart to pump so much harder just to push the blood through. So managing your stress, whether that's through meditation, deep breathing, or just getting outside for a walk, is not some fancy luxury. It is a critical biological necessity for your heart.
And guess what? Sleep deprivation restricts your blood vessels in the exact same way. You've got to start treating sleep optimization as an actual medical intervention. The non-negotiable rules here are pretty straightforward. Aim for 7 to 9 hours of quality sleep, keep a rigid sleep schedule, make sure your room is dark and cool, and please, no screens for 30 minutes before bed. Oh, and I really need to highlight this last point. If you snore heavily or stop breathing in your sleep, you absolutely must get tested for sleep apnea. Untreated sleep apnea is a massive, sneaky multiplier for high blood pressure that gets missed way too often.
All right, part 3, perfecting your home readings.
You know how on TV you always see characters slouched on a couch, talking away while the blood pressure cuff inflates? Yeah, completely wrong. Doing that will give you totally inaccurate numbers. First off, you need an upper arm automatic monitor. The wrists and finger ones, just not reliable enough. Then, you need to follow these exact steps chronologically. First, wait 5 minutes after any activity. Just sit and breathe. Then, sit up properly with your feet perfectly flat on the floor and your back fully supported. Rest your arm on a table so the cuff is exactly at heart level. And finally, don't just take one reading. Take 3 readings, spaced 1 minute apart, and average them out.
Now, you might be wondering, why are we doing this at home in the first place? Well, it's because of a very real thing called white coat syndrome. For a lot of us, just sitting in a clinical doctor's office spikes our anxiety, which artificially spikes our blood pressure.
By keeping a home log, checking it once in the morning before breakfast or your meds, and once in the evening for at least 5 days a month, you're giving your doctor the real, unbiased story of what your heart is actually doing.
Moving into part 4. This is where we pivot from theory to action, your 30-day habit plan.
And this starts with what's on your plate. Get this, over 70% of the sodium you consume every single day does not come from your salt shaker. It's hiding. It's buried in processed foods, restaurant meals, canned soups, deli meats, you name it. And sodium is a huge problem because it forces your body to retain water, which increases your blood volume and directly spikes your blood pressure.
The proven game changer here is the DASH diet. That stands for Dietary Approaches to Stop Hypertension. And the trick is, don't just focus on what you have to cut out, focus on what you get to add. Adding potassium-rich foods like bananas, sweet potatoes, and spinach is amazing because potassium acts like a natural counterbalance to sodium, helping your body actually flush it out. You can also add foods rich in nitrates like beets and dark chocolate to help relax those blood vessels. On the flip side, you do need to keep that hidden sodium below 2,300 milligrams a day, watch the added sugars and processed meats, and try to limit alcohol to just 1 or 2 drinks.
So how do we actually do this without getting totally overwhelmed? We use a 30-day challenge approach. Please, do not try to change your entire life overnight. It never works. First, identify your top 3 personal risk factors. Then, pick just one single habit to change. Maybe that's just committing to a 15-minute brisk walk every day. That's it. Master that one habit for 2 straight weeks. Once it feels automatic, then you layer in your second habit. And all the while, keep tracking your blood pressure, your weight, and your energy levels. Progress compounds over time.
If you take nothing else away from this explainer, remember this phrase: consistency over perfection. Making a few lifestyle changes imperfectly, but consistently every single day, is so much more powerful than doing one thing flawlessly for a week and then giving up because it was too hard. Give yourself some grace, but show up for yourself every day.
And finally, part 5, partnering with your doctor.
Listen, if your doctor prescribes medication, it is not a failure on your part. Let's just drop that stigma right now. Medication is simply a tool, and sometimes we need the right tools for the job. Things like ACE inhibitors to relax your blood vessels, beta blockers to slow your heart rate, or diuretics to help shed excess fluid. But here is the absolutely crucial part. Never, ever stop taking your medication just because your home readings look good for a few days. If you stop early, your blood pressure can dangerously rebound. Always work directly with your doctor to make any adjustments.
Because ultimately, this is what you and your doctor are working toward. For most of us, the big target is getting those consistent home readings below 130/80. Now, keeping in mind if you're a bit older or if you have other conditions like diabetes, your doctor might tweak this target specifically for you. But establish that personal goal with your provider and keep your eyes fixed on that prize.
We've covered a lot today. We went through the science, the silent risks, the exact way to measure your numbers at home, and the lifestyle tools you need to fix this. You genuinely have so much more power over your cardiovascular destiny than you probably realize. The strategies we've talked about are proven to work, but the commitment has to come from you. So here's my question for you. Which 3 habits are you going to choose to conquer first for your 30-day challenge? Pick them today, write them down, and start taking your life back. Thanks for hanging out with me for this explainer, and here's to a stronger, healthier